Okay. Half a day, everybody. Thank you for joining us today. Today we have a press conference, a joint press conference for the Department of Public Health and Social Services, along with Black Construction Corporation and with Dr. Wynn from the American Medical Center. I'd like to first introduce Arthur St. Augustine, the Director of the Department of Public Health and Social Services. And then, of course, we have with us today Terry Uggan, who is the Deputy Director of the Department of Public Health and Social Services. Also joining us today is Mr. Chima Mbakwam, the Chief of Medical Operations with the Department of Public Health and Social Services. We also have with us, of course, the Senior Vice President and General Manager of Black Construction Companies, Mr. Leonard Kai. Thank you for joining us, sir. And finally, we have Dr. Ho Wynn of American Medical Center. And now I'd like to turn over the floor to our Director of Public Health and Social Services, Mr. Art St. Augustine.
Thank you so much, Janella. First and foremost, I really want to express my appreciation to the media for your time this afternoon. I know it was kind of short notice, but we thought it was important enough that we would ask for you to please join us for this press conference. With yesterday's announcement of positive cases in Black Construction Corporation, Mr. Leonard Kai, Senior Vice President and General Manager, along with Dr. Howland Wen of American Medical Center, have joined me this afternoon to provide an update on the situation of Black Construction Corporation. In past months, there has been the request to disclose the physical locations of where positives have frequented. Yesterday is a testament of a private company stepping forward, like others who have, to be part of the solution in our fight against COVID-19. I commend and thank Mr. Kai for self-identifying as we press forward to address the cases at Black Construction Company. Black Construction Company Corporation continues to be cooperative with public health and social services to mitigate the situation at their home front. Testing started over a period of days, starting on October 24th. And with mass testing being conducted by Public Health and Social Services more recently, it has resulted in over 300 positive cases. We continue to test specimens, and our partnership with Black Construction Corporation to test even further is being coordinated by Public Health and Social Services, Black Construction Corporation, and AMC. For DPHSS, coordination for further testing is being coordinated at two fronts: our Rapid Engagement Team and the Northern Region Community Health Center, our Idaho Public Health test site. We have also requested the partnership to join our efforts for continued testing of Black Construction Corporation family with AMC. At this time, Mr. Leonard Kai will address our community on the matter at hand. He will then be followed by Dr. Wen, who will further discuss the details that have been implemented with Black Construction Corporation. Mr. Kai. You need to unmute yourself, Mr. Kai. You're muted. I need to unmute. Thank you.
I'm sorry about that. First, let me thank Director St. Augustine and the entire Department of Health staff. Thank you, Janella, for this opportunity to speak to the media today. And also, I'd like to thank Dr. Wynn for his time this afternoon. In March of this year, we recognize the importance of protecting our workforce. And as a result, we do have over 500, close to 600 H-2Bs on island, besides a local workforce of near 300. We developed a very robust, rigid protocol program to ensure that we're keeping our personnel safe, healthy, and working daily on a regular basis. Due to our practices, we were able to keep our workforce safe for a period of near 8 months. It was challenging, however, we did have an infection which evolved into the situation that we're currently in today. As the director indicated, the numbers are substantial at this point. Um, we'd like to, thank Dr. Nguyen and his medical staff for all the guidance and assistance that they provided us, during this period. We continue to work with both Department of Health as well as American Medical, led by Dr. Nguyen, to ensure that we're identifying all of the positive cases, and we're doing everything we can possibly do to keep our people safe and healthy. I want to ensure the general public and via the media that all of our positive cases have been isolated. They're located in one specific location, we intend to ensure that we continue to work with both Department of Health as well as Dr. Nguyen to ensure that these people will make it through this period, this trying period that we're faced with at the moment. We have an extensive testing program that's ongoing at the moment, and we continue to test all of our personnel. And hopefully by the time this is done, we'll have tested about 1,300 personnel that are actually employees, subcontractors, and or vendors that are dealing directly on our job sites. So, we thank, again, Department of Health. We thank the government of Guam for their understanding. We thank Dr. Nguyen and American Medical for the continued guidance and assistance that we have had the opportunity to be provided today. So thank you very much.
Thank you, Mr. Kai. And now, Dr. Nguyen, for your remarks.
Okay, so, thank you, everyone. I really, public health, I gotta give you a big thank you for stepping up. I have a chance to discuss it with Art, the director there, on Friday, and with Chima, and they make it happen right away on Saturday and Sunday. So I can't say enough for you guys' efforts to mitigate this thing. So just to let the media and public know, this is considered as a cluster, and it's very important to difference between a cluster and something a community spread. And on this cluster, it really is mainly involve the worker that live in the barrack in the compound, and so it's not to any worker, anyone that go outside the compound to interact with the local community. So the chance of spreading to the community is actually very, very small to none. Okay, so it's to kind of recap everything in a short statement here is that basically, the index case is started on sometime the 24th of October or so as a local worker. As you know, every construction site, there's a mixture of different companies, different local worker. And the index case when they identifies October 24th or so. And with black construction, we know that right away. We try to do isolation and the contact tracing. And throughout the next week to 2 weeks or so, we gradually isolate the people that is positive, that were tested positive, and we put them in one barrack. And then we quarantine the rest in another section. Away from the population that is not that asymptomatic. But on Friday, when we identified that there's 22 positive out of our testing, we immediately contact public health, ask for their help. And through Saturday and Sunday, they're testing quite a bit, over 500. And on that case, there's a total now of 312 positive. And out of 312 positive, the overwhelming majority of the worker asymptomatic, absolutely no symptom. It's about 20 or so, or less than 30 people that really have some type of symptom that very mild. So again, most of this positive are asymptomatic. Once we identify them as positive, black construction have, under the guideline, have placed people in 3 different areas. So one is isolation for the positive contact. the second one is a close contact, which is under quarantine at this point. And then the third location of people that test negative to kind of get away from the other two facility. And also even on the negative side, that everyone tests negative, they are not in a group anymore. They be sectioned out in the smaller groups. So that way we will follow up with them, make sure they don't turn positive in the next week to 2 weeks or so. But the whole workforce have been placed under quarantine at this point. So there's no interaction with the community at this point. So that will minimize any risks of infection outside. As Leona say that the testing will further extend to the local skilled worker and also all the staff. So we have quite a bit, several hundred more to test to make sure to reach out to every worker that belong to either Black construction or other subcontractors. So they all going to be tested to make sure that there's no positive out there that happen to be asymptomatic. So again, this is a cluster within the compound. So it's not something in the community. So I just want to assure everyone that the community are not at risk with this high number. So we just want to make sure that the media and community know that. Again, Black have done more than enough in order to try to prevent this happen. But as you see, that it's very hard to control infection when it started. Again, with our blessing at this point, the majority are asymptomatic, very few symptomatic, and I think only one in the hospital. But that's again, that's a very, very small number compared to this this population. So again, we do everything that we can to try to mitigate the spreading of this virus. So so far so good. I said we're looking forward to the next few days to work with public health and the mass testing of the rest of the worker.
Thank you, Dr. Nguyen.
Thank you, Janella.
And now we'll open up the floor to questions. And you may turn on your video as well when you ask your questions. We'll begin with KUAM Nestor Lecanto.
Yeah, thank you. Len, if I can ask Len, can you just elaborate on the barracks configuration? How closely are the beds, for example? How many folks per barracks? Are there different buildings? Could you just give us a better picture of what the situation is at the barracks?
Hi, Ness. Yeah, so we have two barracks, and where our people are confined right now are at barracks number 1, which consists of 2 basic buildings. We occupy on one building, building B, we occupy 2 floors, and each of them will sleep over 200 people. The next barracks will sleep just on the 2nd floor, and that'll add another 100 or so people. Gives us a total of 350 beds available for our H2Bs. Now, what we've done at the recommendation of Dr. Nguyen is we've identified specific people that need to be isolated, and we're isolating anywhere from 4 to 6 individuals per room who are basically positive. And so we're able to isolate them on one barracks on the 2nd floor, which would be barracks A. So that's the current situation that we're in at the moment.
Okay, but so these are all pretty closely situated, though, right? So
they are very closely, yeah, very close together. Yes.
And I'm wondering. I know Dr. Nguyen said that you know that they're all quarantined and that it's a cluster within this barracks area, but conceivably these workers were able to go out into the community in the ensuing what's been 15 days since the index case was discovered. So were these many of these workers out and about at the mall or wherever?
So good question, Ness. And let me just share with you. I failed to advise everyone. Since March, we've had our March 18th to be exact. We had our H2s locked down. They're allowed to go to work and come back to the barracks and not receive any visitors and not leave the barracks. So since then, these H2s have been locked down. You know, obviously we had some guidance internally as well as guidance from Dr. Nguyen in terms of fighting COVID. That was the best scenario for us to take so that we have 24/7 security with utilizing G4S. And we've notified all of our neighbors of the current situation. So we keep a close eye on these H2s. So to answer your question specifically, no one is allowed to leave the barracks. We had one individual leave, I want to say about 3 weeks ago, unannounced, and he was terminated immediately. He happened to be not an H2. He was in a barracks, FSM citizen, and he was terminated. So this is about a month ago that he was, you know, had left the barracks and was terminated. So that's the current situation.
And have you had to stop any work?
We stopped any work?
No.
No, yeah, we stopped everything.
Well, we stopped now, as directed by you know, public health. Today we ceased all operations.
All of your projects?
Every project.
Wow. Thanks, Len.
Yep. Okay, Ness.
Thank you, Nestor. Next is PNC, May Habib.
Hi, Hafaday. I just wanted to clarify what is the date of the first case? This is just a point of clarification.
May the first case is October 24th.
Okay. And did I hear correctly that there was actually it was not an H-2B worker, it was a local worker on Guam who would come and go from the job site?
Yes, May. I mean, every site have a mixture of different company and also for local skilled worker. And the positive is from the local worker.
Every day.
Okay, and so in terms of it being a sequestered cluster, I guess I understand that the H-2Bs are locked down, and I heard that explanation, but all the local people, I mean, it started with a local person, and all the contractors, anybody who's not an H-2B can come and go from the community. So how are we actually sure that there's no community spread?
Answer that question. Dr. Nguyen, if I can answer that question.
Okay.
So as it relates to our local workforce, every day everyone gets their temperature tested. Okay. And then they're questioned on a normal basis in the morning before any work starts. So if anyone has any symptoms or if they feel sick, you know, we're monitoring our personnel, each and every person, whether H-2B and or local, including subcontractors that come onto the project sites. So that's part of our due diligence in ensuring everyone is following COVID protocols. Everybody has a mask. Everybody gets their temperature checked. You know, they're questioned every day about, you know, what they've done, how they feel, if they're able to work, the standard questions that we ask everyone, all of our employees and subcontractors.
Various safety stand downs.
And definitely, and it sounds like the standards are really rigid, but I also hear Dr. Nguyen on the same, you know, note saying that most are asymptomatic, most don't even have symptoms. And so with the temperature checks, with checking for symptoms, asking if people are feeling well, many of them aren't feeling well, but clearly they're infected.
Yes. May, let me go back and try to answer your question on, you know, once we identify a positive, even to local worker, Black Construction have a in-house 24 hours RN that stay in the compound to monitor everyone since March. So what happened is that when you have a local positive, the contact tracing start immediately in-house, and we basically quarantine and isolate the positive and quarantine the rest of the close contact, and we do the testing for close contact after about a week to 8 days or so to make sure that they don't turn positive, and they would stay on quarantine until they're done. So that's the action that they do on every positive contact, either in the local community or in the compound for the H2 worker.
Okay, thank you, Dr. Ren. And my follow-up is just, can you clarify the positives versus how many have been tested so far, and then how many more need to be tested, and what's like the long-term game in terms of getting everybody back into the work cycle and getting construction back and going?
For right now, you know, all the H2 worker in the compound have been tested. I think it's like over 556 or so, and resulted in 312 positive. So that's the current number at this point. Again, there's further testing to be done, and public health will release more information in the next few days as more tests going to be done.
As now, it's got 150 being tested.
Thank you, May. Next is PDN, Steve Limtiaco.
Yes, hi. Can you hear me?
Yeah.
Yeah. My question is for Director St. Augustine. So you mentioned that this information about this cluster is coming out because it was disclosed by Black Construction. That being the case, what's the status of the weekly tracing reports that are supposed to be coming out of public health that would provide more information about where these things are happening?
Just so I'm clear, Mr. Limtiaco, with regards to Black Construction disclosing it, it's actually a collaborative effort. You know, there was a lot of questions about public health identifying places where people frequent, and really, we've always said that we want to cooperate and collaborate with those areas, and so it's really Black Construction Corporation stepping up. Our team does contact tracing, and our EPI team provides that for me, but I just want to be clear, this is with regards to the Black Construction stepping up. It's a collaboration between them and us. The team provides me the data, we get it through the JIC report, and that's the data that we use to gauge our next activities, like the rapid engagement team. And so if you're asking about contact tracing, this actually was Dr. Wennett called me on Friday, as he had shared, and we responded based on the information we received. We looked at all the other cases that were related to this, and then we started doing the mass testing.
So are there going to be weekly contact tracing reports, more detailed reports? These have been mentioned at legislative public hearings.
Yes, yes, you're right. If you're talking about that report, yes, Dr. Pobitsky is still working on that. We're looking at putting more information.
We're actually.
Oh, sorry. Is it okay? Dr. Babitsky and I spoke recently, as I think it was just last week, with our deputy again, and she is working on revamping and updating that with Stephanie, so that they feel that that information would be a lot more useful for the readers on our island and easier to interpret in terms of the data, and maybe not so many charts and graphs, but just data that's easy to read and understand. And we really, so it can be more effective messaging is what we're driving towards.
Okay, and for my follow-up question, this is for Black Construction. You mentioned that your projects have all stopped. What are some of your major projects right now? What are you working on?
We got a $178 million replace housing project for the at Anderson Air Force Base. We have the $84 million program for the Marines at the North Ramp, which includes a warehouse and a helicopter hangar. We have the live fire range, $86 million up at the northwest area. It's the live fire range consisting of four ranges up in that area. And we also have the Northern District wastewater treatment plant, that's a $122 million program for the GWA. We also have ongoing is the airport authority, the third floor isolation corridor that's ongoing now. And we're doing a project for the Limtiacos, PUI, Pacific Unlimited, behind the Barragata Post Office. And that's about a $28 million program that's currently ongoing. So we've got a lot of work here on Guam. And certainly, the one thing we got to focus on is getting our people healthy, back to work. And with the help of public health and Dr. Nguyen and American Medical, we hope to do that real soon.
Thank you. Thank you very much.
Thank you, Steve. Guam Daily Post, Oyal Nirarikla.
Hi, everyone. Thank you so much for this press conference today. I wanted to ask Director San Augustine, on October 1st, this kind of follows on what Steve was asking about. You did talk about identifying establishments and said that there will be further guidance on this in the future. Can we get an update on that? I think it's particularly important considering you mentioned Black construction is stepping up and self-identifying, but as we see more and more COVID numbers, I think the public would be very interested in seeing where some of these cases are hitting. But yeah, can we get an update on that and your guidance from the AG? And whether or not we can get an update, get a copy of that guidance.
Well, actually, we're not able to release the guidance only because it's attorney-client privilege. If I release the guidance at that point, then it's no longer, we're not able to maintain that. And that's what I understand in speaking with the Attorney General's staff. So the guidance is basically, as we had said in the past, as long as it's related to a function, public health and social services. And so we have said also in the past that we'd like to work with our companies, our local companies, where these are establishments where positive cases have been identified, where individuals have frequented. And today is an opportunity to show the community that working together with us can yield a lot of positive results in terms of the partnership, rapid testing, and also working with them to further mitigate any further spread of the virus. With regards to the guidance, we also receive further literature or references from our CDC partner, and we need to review that a little further. One of the questions they actually raised was with regard to identifying establishments is really recognizing the legal liability you have as a department of any legal liability you would have for identifying a company. And so having received that more recently, we're looking at the idea perhaps of actually asking for an opinion as opposed to guidance of the Attorney General. I understand that will take a little longer, but given the more recent information I received from our CDC partners, I felt that perhaps it would merit an opinion to be requested of the AG. And that's where we're at right now. Yes, you're right. We talked about the guidance, and it's really something that we've been deliberating about, and we're still wanting to find that middle ground. We definitely don't want to use it in any negative fashion. It's really intended, if ever we are to disclose the identification or the location, it's really because the entity, agency, establishment is not being cooperative, which is not the case today. And so that's where we're at right now with that. Thank you.
Okay, and for my second question, I don't know if Mr. San Augustine, you'd like to answer this as well, but with respect to people knowing that they've gotten they tested positively for COVID-19, are they able to go to immediately isolate themselves if they and at a government facility if they know that their home is not conducive to self-isolation, especially considering that the highest number of transmissions, according to public health data, is household transmission?
Yes, you are correct. Household transmission at this point is our highest area in terms of transmission. To the question about isolation, the team is working on putting a contact number out for public to use. After hours, I understand it's going to be, I believe, from 10 p.m. to 8 a.m. so that you can contact the isolation facility and they will discuss with you the possibility of someone who is positive, who is sharing their concern that perhaps home is not suitable, that they would then be assessed for admission into our isolation facility. And so that is definitely something that we are working on and putting out a contact number. There's just a few procedural concerns that are being addressed, but I understand the team is working on that, and perhaps later on this week that number will be released. And so individuals who are positive, but short of our, really the message really at the end of the day is short of us having our procedures in place, please call us. If you have you are in a situation where you don't believe your home is suitable for home isolation, contact Public Health and Social Services, do 311, ask for medical triage, contact us, and please let us know and we'll respond accordingly. And that's something that we have to do to ensure the further interruption of the virus in terms of at the home, and we'll bring you into our ISOFAC. So please call us, do not hesitate. Now, of course, if you have a situation that is more dire, please contact 911 and ask for medic ambulance support. Our isolation facility is available as an option as suitable. Thank you.
Thank you so much, sir. If I could squeeze in just one more question, have any other construction companies been told to stop operations?
At this time, I have not ordered to cease operations to any other construction company.
Okay, thank you, sir.
You're welcome.
Thank you, Oya. Next is Pacific Island Times, Ethan Perez.
Today, this question is directed at Black construction. I was just wondering what would happen to your job sites at the moment. Is public health? Oh, if there are several projects that are close to communities on island and high traffic areas, how are we making sure that COVID did not spread into those communities that you were working closely within?
Yeah, thanks for the question. First of all, our camps are in kind of industrial area. They're in the Harmon Industrial Park, away from any public population. So they're kind of isolated in that regard. Additionally, most of our projects are isolated themselves. One of our projects at Anderson, the housing project, is in a very isolated area. Although it's at Anderson, the whole site is cleared in preparation of us building 93 new duplex housing units for a total of 186 3-bedroom, 4-bedroom units. At this moment, the project has just started. So it's a complete cleared area away from the general public. And then our other projects are totally isolated up at Northwest Field, no general public over there, where we're doing the hangar and the warehouse facility for the Marines, no population there. And we have 24/7 security at all of our project sites. So no one is allowed either in, or during the course of a day, no one is allowed out unless they have authorization to leave the project site. That's standard procedure for us.
Thank you. I have no further questions.
Thank you, Ethan. And finally, we have also Ms. Maureen Maritito with Mariana's Business Journal.
Okay. I think you should be able to hear me, and I'm also on camera. I have a question for Art. So you were able to go to 2 clusters in Jigo and test extensively there. Are you now moving from north to south, and if so, have you identified clusters, say in the central and southern area, where you will also be testing in the way that you did in Jigo?
Actually, to your question at this time, the last outreach was still with FSM as our focus. And you may know that was in Estomah this past Saturday. And having the situation with Black Construction Corporation, it has shifted our resources, the rapid engagement team to continue this. So for the next week, I imagine for the next week or so, we'll be working with Black Construction Corporation. The other thing that we are doing is we are actively going to be reaching out to other construction companies that have living quarters in their site, on their site, and reaching out to them and working with them to just be very proactive, making sure that they have systems in place to monitor their employees. So in terms of our next site, it's actually kind of been defined for us given the current situation. And then I can circle back later to perhaps let everyone know what our data is showing with the other sites in terms of our village level. Right now, we're going to be focusing on the construction situation, and we're going to be working for the most of this week with Black Construction Corp, and then moving on to any other construction companies that may have concerns or identifying some more positives that we need to step in there and intervene the best we can to interrupt transmission. Thank you.
Okay, thank you, Art. My second question is for Leonard. Hi, Leonard. So a question and a clarification, please. So the clarification on your various projects, were the teams working in bubbles so segregated, or was there some to and fro between your projects?
Most of the personnel are assigned specifically to projects. We don't necessarily move them between projects. Now that could vary in a small way. In the event we had big concrete pours where we needed more masons on one site, but those were completed about 3-4 months ago on major pours. So we didn't need to move masons, which we normally do on major concrete pours. So normally when we send, at this point, our workforce is concentrated to a specific job site. Whether it's H2, local, even the staff, they're all focused on one job site.
Okay, thank you. And my question, I just wanted to get your expert opinion. Art is talking about testing other construction companies, but to date, except for 1 or 2 isolated incidents, it's my impression that there isn't really a lot of COVID in the construction industry. Could you comment on that?
Is that for me? I'm sorry.
I think that would be a fair statement. I can't attest to the other construction companies. I was told that there could be some positives on another contracting company, but I don't know the extent of that. Right now we're more concerned with wall-to-wall testing to make sure that all of our people, whether they're staff, whether they're local employees, or even our foreign workforce is tested, and we're assured that we've identified all of the positive cases and we can isolate them and get them back healthy and back to work on a more positive basis. So I hope that answered your question.
Yes, it did. Thank you very much.
Okay.
We haven't had a lot.
Thank you, Maureen. So I'd like to offer Leonard, if you'd like to give some closing remarks, and then over to Director St. Augustine.
Thank you, Janella. Again, this is kind of a unique situation for Black. We're fortunate that it's a cluster, as Dr. Nguyen has identified, and we're hoping to get our people back healthy and back to work as soon as we possibly can with the guidance of public health. We'll see how the remaining testing goes, and we can identify those positives that may occur in the future testing. And other than that, I thank the media for and on behalf of Black and Department of Public Health, Dr. Nguyen and his staff, and Janella. Thank you very much for the opportunity.
Thank you, Mr. Kai. I appreciate that. Director San Augustine, your closing remarks.
Well, thank you so much, Janelle. Like Mr. Kai, I too would like to extend my appreciation to the media and for your questions this afternoon and really helping us send the message out. And this partnership between AMC, Black Construction Corporation, and Public Health and Social Services is really what we're asking all the private businesses to engage with us. Should you have a positive, we're here to work with you. We're here to move our island forward, and so that we too, as a community, can move forward collectively. But Dr. Nguyen, thank you again for your expertise, your support, and reaching out to me. I really appreciate that, the communication you give me. And Mr. Kai, thank you so much for stepping up and identifying Black Construction Corporation and just working with us through this process. And again, thank you all very much, everyone, for your time this afternoon.
Thank
Thank
you.
you. And also,
if I could add one more item for Black. I just want to say that Dr. Nguyen and AMC has been our QC medical advisor since 2018. So he's provided a wealth of guidance for us along the way, even before COVID, pre-COVID. So he's been a vital part of the Black organization for some time now. And I just want to extend that to our thanks to Dr. Nguyen.
Thank you.
Thank you. Also, our Deputy Director, Lori Duenas, is here. I just wanted to acknowledge her presence as well. She wasn't here earlier when I did the introduction. So Deputy Director Duenas, thank you for joining us. I just wanted to give her the floor real quick if you wanted to give some remarks as well. Okay, I see her shaking her head. Thank you, Deputy Director. Dr. Nguyen, just wanted to recognize you as well. I don't know if you want to give some remarks real quick before we close.
As I just said, we all discussed about the disclosure of the company that serve Guam for any capacity. I think that it's important, just as Black did this weekend and a few companies did in the past. It's important to engage, public health in this mitigation effort. Just because that we engage public health, the faster we can mitigate and prevent the spread in the community. So it's really, again, thank everyone for doing it and reassure the public again that this is strictly the cluster within a compound and it's a very minimal impact the community. As you can see, the large number, and not to worry, just because again, it's a cluster, it's not a community spread. So, and we handled it very professionally along with public health at the onset of this. It should span out very well. Again, we're going to continue to look at other companies, make sure that the spread in the construction company. So far, this is the first one, so it's we expect that. But again, if we act rapidly, we can mitigate any spread in the community and at other company. So thank you so much for everyone's effort.
Thank you, Dr. Nguyen. Thank you, Director San Augustine. Thank you, Mr. Kai. Thank you, everybody, to the media for your patience and for joining us today. That concludes our press conference.